Oshawa. If you're not able to email, you can also text it. The cell numbers are there on the screen for you to see which two cells you can, either one you can text it to. And the priority is going to be for questions that are from the BIA members. We're going to try and address as many of these questions as we can over the morning. So I hope that helps paint the picture. We've got some guest speakers we're going to start off with. So I'm just going to turn off my screen sharing here.
Holy.
Yeah, there we go. And I see all kinds of faces. Isn't that lovely? So I'm just going to take a quick moment here. We're going to introduce you to our three guest speakers today. The first is going to be Derek Giberson, who's going to be representing the Backdoor Mission. We also have Jeff Dart from the Welcoming Streets program at CARIA. And then our final guest will be Daniel Cullen. I'm sure most of you, if not all of you, know who Daniel is. He's going to be talking about some of his lived experience. And each of our speakers is going to have about 5 minutes, and then we'll get into the Q&A portion. So without any further delay, I'm going to hand it over to Derek.
Thank you so much, Paul. Thank you to the BIA for having me. I'm going to try and get my slideshow up because although I failed grade 8 art, and it's not going to necessarily be pretty, it might be helpful in conveying information. So a quick introduction, and Paul, can you just give me a thumbs up on your screen?
There we go.
Dan, can you see that? No? Yes, okay, good. A little bit of a time lag there. Yeah, so as mentioned, I'm the current board president at the Backdoor Mission. A little bit of a misperception is that I work there. I don't. It's not my day job. I'm a volunteer board member. However, basically since the pandemic, it's felt a little bit like I work there. But that is starting to ease up a little bit, and I can go back to my other job, my day job, which is as a city councilor for Ward 4. So just very brief history on this, and just before I forget, I'm going to set my timer here so that I'm watching the clock, because I know I've been given 5 minutes and I've probably used up a minute of it already. So the Backdoor Mission started as a fairly low barrier place for people from the marginalized at-risk population to socialize, to get coffee, snacks, St. Vincent's meal tickets, etc. Since the pandemic, it's been operating in a partnership that we've called informally Mission United, which is many different service providers under one roof. And it's having tremendous success with many of these individuals in helping them improve health outcomes and so forth. I'm not going to go into a lot of detail on it. What I am going to say, and I hope everyone that's attending today or who may be watching later knows, if you're a downtown stakeholder and you want to understand better what's going on there, you can reach out to the mission and we can set up a tour. We're happy to do that. We do tours all the time. We are more than happy to get people informed on the work that's going on downtown to help with the population. So what I'm going to do with my presentation here today is, let's see if I can try this again. There we go. Okay, I'm gonna kind of take a higher level look at things today, rather than go into fine details of all the services at the mission. And I'm just going to start with a question, and there's going to be 3 things that I hope are takeaways today. If you forget everything else I say. So how did we get here? And by here, I mean the challenges that we're facing downtown Oshawa, and you wouldn't be here if you didn't know about them already. So one of them is a national opioid crisis. I'm not going to belabor that one either, because I'm sure everyone has read about it. Everyone's heard about it. If you haven't, I highly encourage you to do some more learning on it, because it really is one of the major factors. There are many factors, but this is one of 2 I'm highlighting today, 2 major ones. So that has exacerbated, homelessness, low income, not always low income, though, challenges with this opioid crisis. And the other one is a national housing crisis. And this one is really, really important in terms of context. And I'm gonna highlight this one by using this bar graph that's in front of you. So this is housing units specifically for the Durham region that were built going back to the 1960s, nonprofit affordable housing in Durham region. And you see that in the 1960s, 1970s, it started to rise the number of units built in various programs, federal and provincial programs. It really cranked up as you hit the mid 80s into the mid 90s. And then remarkably, it just completely drops off of, the faucet is just shut. So to today, up until the National Housing Strategy that's beginning to be rolled out. So with that, this is one of the most important, factors in why we are facing what we are facing today. And it's really not as much of a mystery as I think many of us think it is. And is it just in Oshawa in putting this forward? So that was for Durham region, but if you can take the same chart and it can be extrapolated to regions and cities all across the country. And it's basically, the chart will look the same. And on a federal level, it will look the same. So is it just in Oshawa? Well, we hear about it here when we're kind of focused on our own bubble, but it's happening in Peterborough, it's happening in Toronto, it's happening in Brampton, Niagara Falls, Windsor, Sudbury, Burlington, Kingston, Kitchener, where else? London, Ottawa. I could go on and on. Halifax, Moncton. Now we're into New Brunswick, Quebec, Manitoba, Prince Albert, Red Deer, Alberta, all the way to British Columbia. This is happening all over the place. This is not a unique to Oshawa problem, and this is one of those three takeaways. Is the problem is not unique to Oshawa. And I think that context is very important as we tackle this. So moving on from that, why downtown Oshawa? So obviously there is there's a more acute problem in downtown Oshawa. And the answer that we often hear is because, well, the social services are there. That's partly true, but that's not the whole picture. So in about 3 years ago, the United Way of Toronto, York region commissioned a very important study on neighborhood income gaps across the GTA. Now, you don't have to squint your eyes. I'm going to zoom in here in a moment just to show you how that plays out in the region of Durham. So in the region of Durham in 1980, here is income disparity based on neighborhood. And you'll see that sandy color represents fairly even, in terms of people being close to the median income. The blue areas are higher income. The red areas are lower income. You jump ahead 20 years, and then we see that disparity starts to spread out over 2 decades. And remember that housing picture, how that changed in that time. And then you jump ahead another 15 years to just 5 years ago, and we see that disparity starts to become even broader. And when we zoom in, it's a little bit grainy, but when we zoom in and we see downtown and central Oshawa, South Oshawa, we see that it truly is acute in this area. Now, the reason why this is important, when we talk about the idea, well, if we move the social services elsewhere, would that fix the problem? The answer for that is probably no, because the socioeconomic disparities are very acute in that area, and people aren't just there because of the social services. They're also there because their social networks are there, because the most affordable, even if it's very poor quality housing, is there. And they're also there because in downtown areas, and this is again not unique to Oshawa, in downtown areas, there's more public space, and the social connection and the public space connection are critical to understanding why lower income areas or lower income individuals may be spending more time in those areas. So, if you took the social services out, yeah, you might reduce the number by 20%, maybe even 30 or 40%. But then the ones who are left behind are going to be in even rougher shape and even more challenged. And it isn't going to be a solution for our problem. So, so it really requires a human-based perspective in that regard in terms of how we approach these issues. So that's that second takeaway, that removing the services won't solve the problem. In fact, it would likely make things worse. So then that's leading us to my final question before I wrap up, which is, where do we go from here? We can't just throw our hands up in despair and say there's nothing to be done about it. Here's what I encourage people to do always in a very short amount of time. Obviously, I could get into the fine details, but it's important that all of us are committed to building our knowledge, to educating ourselves, to talking to those who are experienced, those who have background in these areas. For a whole bunch of reasons, education is power. If we understand it, it means that we're not approaching it from the wrong ways, we're trying to approach it from the right ways, but it also helps us all get on a similar page with other stakeholders. It's better for us to advocate with a unified voice. It helps us a whole lot more when we go to higher government levels of government. You know, the City Council of Oshawa is not in the business of housing. That's been delegated on the Municipal Act to the upper tier of governments. It helps if we're all together and advocating with a unified voice instead of pulling in 17 or 50 different directions. So that's sort of the where do we go from here in a very, very small nutshell with a limited amount of time today. So, you know, finally, my third takeaway is that the journey in front of us isn't easy, but it also isn't hopeless. So
Right.
I'm going to wrap it up with that. I am going to just
All right.
say one final reminder, or I'm going to let you in on a little secret, is that, yeah, sometimes you experience frustration with the things that you may have to deal with. I live downtown. It's not fun for me any more than for anyone else to have to step over human excrement, for instance, or to see, and have to avoid a pile of used needles. So, you know, those are frustrations that I share, but I'll let you in on a little secret. Even those who work in the social sector, in mental health, in addiction services, they also have days when they get frustrated as well too, when at the end of the day, they're burnt out, they want to throw in the towel, and you know, they feel unappreciated and that their efforts are not working. So, you know, that's part of being human. That's part of dealing with very complex human challenges. So this really is about trying to you know, chart a journey and travel that path and work together. So thanks for listening. And speaking of building education, I really hope you listen in on both Jeff and Daniel's comments now, because they're going to get more into the fine details. So look forward to the questions later.
Thank you, Derek. That was excellent for having just such a short window to try and encapsulate so many things, particularly the maps and the chart showing the change in affordable housing. Stark things to be able to see firsthand right in front of us. Excellent. Thank you. So again, folks, if you got questions related to that, comments related to that, throw that into the chat box if it's a question so we can capture it. I just want to add to, I apologize, I did forget to mention in the beginning, of course, that a summary of the meeting is going to be available by the 23rd of September. It is being recorded. It's going to be available through the downtownoshawa.ca website. And later today, you're going to get a link for a quick survey in your email about today's session. So now we're going to head over to Jeff. If you want to, Jeff, are you unmuted? He's unmuted. Great.
Unmuted, just trying to pull up the presentation here.
Great.
I managed to make it through grade 8 art, Derek, but I failed grade 9. So we'll see how this goes here. All right, so I'm here to talk about the Welcoming Streets program. I'm sure a lot of you have heard a lot of information about it. The program started officially hit the ground in November of 2019. So we're almost on our first year of completing it, partnership with the Downtown Oshawa BIA, the City of Oshawa, as well as Caria Community Health Center. It's being modeled after a program in Guelph that brings targeted outreach services to vulnerable community members in the downtown core, as well as education training to the businesses. Oops, my slides aren't going very well here. Here we go. Through the Welcoming Streets, partners are helping to bridge the gap between business owners, community members who are vulnerable in the downtown. The aim of the project is to foster a safe and inclusive and welcoming environment for all by supporting business owners, residents, community members, staff, when they're in need of assistance. Through the initiative, a community-based outreach worker, a health promoter, serve as the first point of contact for the individuals. And we've also linked in our hepatitis C and harm reduction teams into the Welcoming Streets program as well to provide some additional support. So they're the first point of contact for the unsheltered and vulnerable, help provide connections, outreach services. They're going to support education training for the businesses. And I updated this, we've hired a second outreach worker. So, and we're hoping to bring a third one on in January of this year, as we've received some additional funding from the region to help us out with this project. So when do you call welcoming streets? So persons escalating in possible distress, support or referrals to business for unsheltered persons, persons' safety concerns, so substance use, seeming unwell, drug pair, heat and cold alerts, business support, resource education, and seeking clarity of who to contact and what to do. So we've also worked very closely with Durham Regional Police to provide some additional assistance. So when the staff are on the streets, if there is something, we have some direct numbers that we can contact the officers in the downtown core, as opposed to having to go through either the non-crisis line or calling 911 in those circumstances. So the client interactions include wellness checks, general support, practical assistance, personal support, safety referrals, client requests for resources, clients sleeping or loitering on street property. The staff have, done a lot of work with the Mission United, referrals to CMHA. They've walked clients down to CMHA. They've done a lot with the Oshawa Library, as well as a handful of other businesses in the downtown core. So calls for support for the business. So drug paraphernalia, again, persons sleeping on the street or property, safety concerns, seeking clarity of what to do, requests for education, person support, escalation, referrals, kind of that. You can call Adam and Lindsay on the Welcoming Streets team, and they can help direct, provide education. They've done a number of workshops. Some of the education include crisis prevention education, naloxone training. We did a Bridges Out of Poverty training back in, I want to say it was January. It seems so long ago. I know it was pre-COVID, so everything pre-COVID seems like it was almost 2 years ago now, as well as Substances 101. To date, they've done 17 education trainings, and they have 2 more Zoom education sessions upcoming. They are willing to do a one-on-one session with the businesses. We understand that it's hard for some of the small businesses to be able to get out to a presentation. So they are also willing to do it virtually. They're willing to come in and sit down with the business owners and the staff and explain some of this stuff, go over the naloxone training, go over some of the substance use, the crisis prevention education, kind of stuff. So whether it's a group of 20 or it's an individual, the staff are willing to go to the businesses and provide all the necessary supports and education that they feel they need. And just like the unsheltered individuals on the street, with some of the business owners, it's going to take 3, 4, 5, 10 visits before they may be comfortable going to the staff. It is education. I know I've been with the staff on the streets a number of times, and it's eye-opening. I was born and raised and lived in this area my whole life, and I know the first time that I did a street walk, I knew there was a problem. I didn't realize the problem was as large as it is. So the business visits include education, introductions, check-ins, drug paraphernalia sweeps, providing resource information, checking property for hanging out, sleeping, other substance uses. The primary referrals have been for the unsheltered have been for primary care and counseling services, food security, housing, shelters, crisis beds, harm reduction, legal aid, drop-in programs, shower laundry, financial aid, also ID clinics. So one thing Carrie is looking to do is actually help with ID clinics. I know John Howard Society does one, but if we can have more that can help and integrate services, and I know we've worked with Paul quite well over the years, so providing these services to the individuals. The outreach supply, so they're doing snack packs, water bottles, hygiene kits, socks, underwear, disposable body wipes, blankets, backpacks, freezers, popsicles, and then face masks. And so the meetings, advisory meetings, coalition, general information sharing, community event planning, partnership building, and strategic planning. One thing Carrie is going to be working on is I just forgot the word, a needs assessment. So we'll be talking to some of the downtown businesses to see what are the needs, what kind of services can Carria provide to the community. So there's for more information, you can contact the Welcoming Streets at carria.ca, or that's Lindsay's cell phone number, so 289-355-8938. The other project that Carria is currently working on in partnership with the city of Oshawa and faith-based communities, and I know Donna has been part of this, is the Spirit of Service. So we do have a staff on who is dedicated to the Spirit of Service, and that is looking at the refugee model of housing, using sponsorship from faith-based communities, community partners. The region of Durham has given us some funds to assist with this, and finding housing. And it's not just a matter of finding a place for these individuals to live and say, okay, there you go. It's providing the wraparound services. It's providing support. It's providing the medical, the counseling, the addiction support. Their first stop may be a treatment center before we can get them housed. Our goal is to have three individuals or families housed by the end of March of this year. And we are, I think we're well on our way to achieving that goal. And there'll be some direct referrals coming from the Welcoming Streets program right into the Spirit of Service program. So, and then connecting with community partners and to see how we can all help these individuals, because it's not just a matter of, like I said, putting them in a house and saying, okay, there you go, that's all you need, because that's not what they need. They need job training, they need education, they need medical counseling, food, they may need help with transportation, and it's that complete wraparound approach. And it's using our neighbors, using our family, our friends, and whoever else we can to help these individuals, because a lot of us come from backgrounds where we have those supports, we have that family, we have those individuals who can help us out, and some of these unsheltered individuals don't have that, and they're looking and they want to improve their life, they want to get better, and they want to succeed.
Great. Thank you very much, Jeff. Keep your mic on, because there's a couple
Okay.
questions, and I'm great. This is really great to see you guys posting the questions into the chat. Keep them coming. One of them there is somebody, where to go? Robert. He was asking, for example, specifically about your program. Is it a city initiative or regional approach? Do you want to speak to about the way that Welcoming Streets is currently?
So the Welcoming Streets has a partnership between the city, the downtown BIA, and Carria. So our focus is the downtown Oshawa. This might be a program that grows across the region over time. I think there's a huge benefit to it. But right now it's focused on the downtown core, as the partnership is the city and the BIA.
Great. Okay. So I just wanted to tackle that one, just to clarify. We're going to come back to some more questions in a moment. We have our next speaker here, Daniel, who's going to go into his lived experience stuff. I think you'll have to unmute him, because I found when I tried to unmute mine, it wouldn't let me do it.
There we go. I'm unmuted. Hello.
Thanks, Jim. Much appreciated. Daniel, the floor is yours, sir.
The floor. You know, I always think of the show X's and Squares, you know, Hollywood Squares, when I get on this thing. It's all, anyways. Good afternoon or good morning, everybody. It's early morning. Everybody likes me to talk about my lived experience. I guess that's what I created. I got what I'm here for. I came to Oshawa on purpose. I came here. I was invited here about 6 years ago by a friend of mine to speak, and he wanted me to tell my story to his people, to the congregation. So I did, and I told my story, and then I went home that day, but Oshawa stuck on my mind because he drove me around and showed me a few things, and he a little bit about the community, and he doesn't really know much about the community other than going to the shelter and talking to the people on Wednesdays. So I came back on my own and didn't tell anybody I was in town, and just wandered around and took a look at the services that were here. And I decided that, you know what, I'm going to set my feet down here, because there's an opportunity here where there's a challenge called homelessness, yes. there is a lot of opportunity here for things to happen. And so that's why I came to Oshawa. Let me tell you a little bit about me. Now, I came to Oshawa on purpose, and here I am. Go ahead. Way farther ahead than I ever expected. Now, when I started, here's a few of the cities I've lived on the streets as a homeless person over the 25 years. Vancouver, Prince Rupert, Prince George, Fort St. John, Kelowna, Calgary, Edmonton, Grand Prairie, Sexsmith, Regina, Moose Jaw, Winnipeg, Kenora, Toronto, Ottawa, Quebec City, Edmundston, New Brunswick, that was a town, Moncton, New Brunswick, St. John's, Nova Scotia, and Charlottetown, PEI. The only place I haven't lived as a homeless person in Canada is in the territories and the province of Newfoundland. And so I guess I've got a Canadian perspective about what homelessness is. Derek, I like that thing that you went through, all those pictures coming up. I was cheering. I think I was on mute. I hope I was, because I was kind of cheering along the way. Nobody ever decides that they want to be a homeless person. I sure didn't. I was a pretty rambunctious young kid. I mean, back then it was youth at risk, or no, juvenile delinquent. Now it's youth at risk. Back in the 70s, we were called juvenile delinquents, and I was one of them. I was just full of vim and vigor and didn't know how to behave myself. My parents had enough of me, and they said, at 16, if you want to be on your own, go ahead. I was naive. I was wet behind the ears. I thought I was the talk of the walk and I could take over the world. You look at all the young people that are coming into town as homeless people in downtown Oshawa, and you know, and they walk like they're 10 feet tall and bulletproof, and some of them are really rough and been through some hard experiences, but there's still a wetness behind the ears. There's still something that has to be learned by age. I wasn't that smart, and when I was 16 years old and thought I could hitchhike across Canada, I did. But by the time I got halfway back, I ran into 3 traumatic experiences that absolutely wrecked me. It left me in trauma. A lot of people that are on the streets live in trauma. So I spent, actually 80% of the people that live among the ranks of the homeless have some sort of mental disorder, including addiction. So when you have a mental challenge, you're not thinking clearly. It's what, you know, it's your thinking is skewed by your chemical imbalance or your drug addiction and the traumas that you're dealing with. I didn't function well for 25 years. I wasn't a well-liked person. I was a non-compliant when they ended up in the psychiatric wards. I was a non-compliant. When I ended up in town, I got chased out of town. I created a great disdain for the police services because they kicked me out of sleeping here and kicked me out of sleeping there. And if you get mouthy as a homeless person, who are considered, you know, insignificant nobodies, you get roughed around a little, getting pushed around a little bit. So I became a very antisocial. There was a sense of entitlement came, and it wasn't an entitlement that came because I think I'm entitled to this. It was an entitlement that happened, a sense of entitlement that happened because the system is created to keep me moving. The soup kitchens are open this time. The beds are open at this time. You got to get your ID at this time. You got to go to the clinic at this time. So they got you moving around like this. So there's no stability in your life because, I mean, I think it's something like 10 kilometers or 2.5 hours a day that people have to walk. So I think something like that. Christine brought it about one time, just to get their appointments done. So my life was not a good one. I understand the downtown core a little bit. I'm never going to say I understand it all, because when you think you know everything, you just learn something new. I work now, I do a lot of things, but the job that pays me is the backdoor mission. I am a peer support worker along with Mitzi, and I'm finding something in the downtown core. If I want to fix a problem, I want to invest myself into the problem. So peer-to-peer supports and peer-to-peer outreach is a part of the national program for I keep forgetting, I sit on the committee too, and I keep forgetting the name for the program, but the national housing program that we have, Housing First, anyways, in there we have Built for Zero homelessness program, a Built for Zero homelessness program. And in that Built for Zero homelessness program, they have a component for peer-to-peer supports. So I've looked at the best practices for peer-to-peer. But now what I do is I get into the community as a peer, and now that people are beginning to see that equals, somebody that's able to understand where we are coming from, or understand how we feel, or understand the exasperations of the stuff that goes on. We're in the community along with welcoming streets, but we're in the community just chilling with the community, walking with community, and we're starting to see that we get out into the community and we do rounds, and we just keep, and we're not out there trying to say we're going to fix your problems. We say, how can we help you? How can we get this for you? How can we help you here? We have services over here, and we find that we talk to a lot of people, and we get those people coming into services, and those people are finding services and finding themselves getting housed. And then we go back into the community. When those people are, we work with those community as peer outreach workers. And as outreach workers, we support them on their journey. And we go back into the community and work with more people and help those people come to the shelter, the hub. And then we support them through the system as peers.
Okay, Dan, so I apologize that I'm cutting off a little bit there, because we do want to get to some of the questions that folks are coming at. Do you
turn you on and I'm on.
To kind of wrap up what you want to cover there?
And in 1 minute, upstream problem solving is what needs to be done. You need to you don't want to say the problems here, and there's a lot of challenges on the street, but the solution is to work backwards to the beginning where the problem starts, and help the community to reestablish itself and find its true potential. It's okay to give them a hope that's bigger than the challenge they face. Once you do that, that person will rise to any level they choose, because it's their hope, not your hope.
Excellent, thank you. Great way to wrap that. So we have had a number of questions come in through email and so on. So for example, one of the questions we've had come in is, could the various humanitarian outreach platforms join forces? I will just say ever so briefly that in terms of John Howard Society, we are always looking forward to the opportunity to work with our fellow agencies in Durham for those kinds of solutions. For those of you amongst the business owners, probably not aware, but there are many different committees in Durham that bring these agencies together to tables, like the Durham housing committees and so on. Jeff, if you wanted to comment on that, or Derek, if you wanted to comment on some of that stuff about how we all interconnect.
Yeah, so there's it's hard to say exactly the number of committees, because there's a homelessness committee, there's community advisory committees. I'm going to say Carius sits on probably 35 committees across Durham region, and there's a lot of different service providers on them. I know the Welcoming Streets, they have had started a committee pre-COVID with PCP, John Howard, Cornerstone. There's a bunch of different community partners. So we do work together. We do, when we're looking for funding opportunities, it always looks better to funders if there's multiple organizations working together to meet the goals and the needs of the community. I know we've done a lot of stuff with Paul over the years, with John Howard, and like I can go on and on about all the businesses and other service agencies in Oshawa, as well as in the region that we work with, and it's mind-blowing the number of agencies, and we do work very closely with them. We do communicate. We don't want to be duplicating services. That's the big thing, is funding dollars are at a premium. So if John Howard's doing something, then we can complement it. We will work together, and vice versa. And I know that we use John Howard space for our harm reduction outreach team as well.
Exactly, yeah. We're not looking to duplicate services and overlap. Although even within the services that each of the agencies provides, we often find our teams can be overwhelmed. Like our housing team at John Howard Society right now, we've got 7, 8 staff. And that is not nearly enough to serve a population of 600,000 Durham region wide. They are swamped every day with calls, especially now with the COVID stuff. So yeah, there is a lot of communication that goes on between the organizations. Actually, in our annual report, this year I write our annual report for John Howard. Most of the prior years, I've got a chart that actually lists how many committees that we're connected to, and as Jeff mentions, there's like 30 of them amongst the different services. That's not just all housing committees. It's all kinds of committees, like domestic violence committee and things like that. So, Derek, did you want to comment on that too?
Yeah, I mean, I think that Jeff mostly touched on it. I think that the last couple of years in particular have been quite strong in seeing a lot of growth in those partnerships and just sort of the inter-stakeholder conversation to see what others are working on and what's working and where there are still gaps and so forth. So, I think that, and the Mission United project is a good example of that. There's, I think, 6 agencies working under one roof right now, which means that you can have somebody in there maybe just to get lunch outside, and you can have them brought in if they need to see a nurse. Maybe there's a wound that just needs to be cared for, and it's very easy to just, if there's another need identified, to just walk them right down the hall, and now you can talk to a social service worker from the region of Durham that can get you on your OW or your ODSP, or you can come and talk to an addictions counselor or a mental health counselor. So that's, maybe to that in terms of the Mission United context. But I think that we've seen really great collaboration between the agencies, and it really is necessary.
Another element of what's out there too is the need for legal services. Again, I'm not sure if folks are as familiar, but there is an organization called the Durham Community Legal Clinic. I sit on the board there. They provide poverty law services. And again, here's another realm where the housing issue is a big issue. A lot of landlord and tenant stuff that goes on. The Durham Community Legal Clinic are paralegals. And they've now got 2 staff lawyers that work in a couple of areas of law, like employment law, human rights. And that's just in the Midtown Mall. It's just outside the BIA boundaries, but they have a hub that has been developing with agencies so that when somebody comes in for a legal matter, as you've heard from others like Jeff, there's more than one issue going on in an individual's life. And as you've heard from Daniel, lots more going on. So by having these kinds of hubs, it saves them that trouble of having to do 2-3 hours of traveling around to get to all the things that they need to do to get the help that they need. Now, there are a number of other questions that come in. I'm going to try and get to these. With combined efforts, could there be a focus on reopening of SVK? I'm actually a little unsure what you mean by SVK.
I think that's St. Vincent's Kitchen.
Oh, okay. Sorry, St. Vincent's Kitchen. Okay.
It would be hard for us to speak on their behalf or on their board's behalf here. I know that the big issue that they were challenged with was having a fairly older age demographic amongst their volunteers in a very tight space. So, I think with the pandemic, that's been one of the things they've been challenged with. But yeah, it would probably be best to ask them, because they are obviously, I think it's well known, a big piece of the food stability picture. So that obviously has been a real challenge with them being closed, but everyone's doing their best to try and plug those holes.
Excellent. Can you inform what areas the unsheltered population are coming from?
Yeah. We hear it's a very transient population. Some individuals are coming from Peterborough, Kingston, like Daniel had mentioned when he was living rough. He lived, I don't know how many cities you named, Daniel, quite a few. And also seeing that Oshawa is on a major transit route. There's individuals coming from Toronto. It's hard to track. It's not just a matter of us walking up to an individual and say, hey, where are you from? A lot of the time, these individuals, we have to build their trust before they're going to tell us anything. And it could be talking to them 12, 15 times before we get any information to find out how we can help them. And then we get the story. But yeah, it's not just a matter of they come with a badge saying, hey, I'm from Toronto, I'm from Peterborough, I'm from Kingston, I'm from Guelph, Kitchener. They're coming from all over Canada.
So I'm still going through questions that came in first through some emails and stuff. And we're seeing the ones in your chat. We're not ignoring you. Just let me get through the ones that came in that are getting fed over to me here. Will less population of the unsheltered decrease criminal activity in our downtown area?
Not all criminal activity is coming from the homeless community. We are in an economic. That chart, Derek, was amazing. How you showed how the economy and how we are, our economic level in the downtown core is rough. So you have people not only that are homeless, and sometimes there's criminal behavior and there's criminal mindset. And sometimes the criminal behavior crosses over to people think it's a criminal mindset. Sometimes you do things just to survive. You wouldn't do it if you didn't have to. So if we had more services for the community that alleviates their thought that I need to do something to get something, that would eliminate that. But not all the crime comes from the homeless community. There are housed people in the downtown core. There are people that are living that aren't homeless. Crime is not just a homeless problem. If we bring solutions for the opioid problem and we deal with that from an upstream problem solving and not just try and band-aid solution every time it comes up, if we fix it upstream, it will alleviate the need for people to think they need to commit some sort of crime to get their next fix.
Yeah. And like Daniel said, and Derek said previous, the opioid crisis isn't an Oshawa issue. It's a national, it's a world issue right now. It's all across North America.
Yeah.
And there needs to be a national solution to this issue. So it's not just Oshawa. And I know Mayor Carter's very passionate about it and very passionate about getting this on the national map.
And John Daniel, for example, we're seeing your comments there. You commented how your feeling is that this is something that's bigger. You're going to see different levels of what these things are like for effects in different cities. Yeah, Oshawa is probably a spot where there's a lot more impact right now versus some other smaller areas and so on. But it's going to be all over the map everywhere that you look. Derek had presented a series of examples in his articles about where these kinds of challenges were popping up. There's a question for you, Jeff, and this is going back a little bit, just how far behind we already are. Great, these questions are coming in. Please keep them coming, folks. The question was, are you finding it difficult for your Hep C teams to work without a permit? We've heard on the street that the team was told they couldn't do testing a few weeks ago.
I haven't heard directly from, I don't manage the Hep C harm reduction team directly, but I haven't heard, I've heard the permit issue, but that, to me, that was more around giving out food and meals than providing outreach services. And as far as I know, that's what the permit issue is around. It's the handing out meals in Memorial Park, etc. Because you do, like, there are requirements, food handlers permits, that's a region thing as well. So
yeah. John, who's been doing that, John Walker, who's been down there doing that. I'm sure everybody saw some media coverage about that. Yeah. Question for Derek. Is it possible to arrange a tour of the new CDN office space above the back door mission?
Well, whenever we give tours of the space, I don't see why not. I mean, there's not really much to see. It's just sort of a place where they can get out of the rain for a few minutes between shifts if they need to. Like when we tour the building, it's usually to show people the social services, but if somebody was specifically curious about that, or also upstairs is the staff lunchroom, and there's some office space upstairs, so it's not much to see. But if that was part of someone's curiosity while they were touring the mission, then yeah, sure.
Okay. Angela and Taylor, have you got another sort of in order of received set of questions? Because I'm trying to keep up between the chat and the email ones that came in. Something you can just quickly forward me for exactly the next order and stuff.
There is one thing, Paul, if I could come back to, because you had touched on it, and I can't remember who spoke to it, but just some of John Daniel's comments. It took me a little bit to read through it there. It was a small book, but it was there was some good comments that were made in that, and they, for those of us who are trying to grapple with the safety question of downtown Oshawa, there is certainly, in my previous life as a professional musician in the Canadian music industry, I've had to be not just in cities across the country, but also in their downtown cores where they deal with similar issues. And, the Oshawa is generally a safe city overall. And I certainly feel safe when I'm downtown, but I do want to qualify that with the fact that I'm a white hetero, cisgendered, male of medium stature. For me, measurements of safety are different for other people based on what their situation is and how they fit in terms of that, safety and privilege and things like that. So, there are different factors. There are a few sides to that coin. And one of the things I do try and remind people is that when you hear some dreadful news about someone, getting attacked downtown Oshawa, for instance, it's very important to understand that there are, occasional cases where it is, someone who is just a quote unquote average citizen, but that's fairly rare. Now, we do know of some of the seniors in the buildings around the park who have actually been assaulted. That's not just a perception thing. They have actually, unfortunately, had to deal with situations like that. But by and large, the question of safety, and when we hear of things that happen, it tends to be intra-population violence. So it's one marginalized individual on another. That tends to be the lion's share of those events, which of course further marginalizes them, right? Safety is sort of it's a fairly complex nut to crack. It's not as simple as that safety is this percentage and it's always safe. It depends on who you are and it depends on where you are. But I do agree that compared to many cities, it's not the picture of chaos and unsafety that maybe sometimes you see it painted as in some Facebook groups and things like that. But we do have to be careful about making generalizations. I did want to speak to one question that came up about housing, I think from Galen. It's actually it's a very fair point, and I can touch on that very quickly. And even in my conversations with the BIA and stakeholders, they've said, we want to help, we want to be part of the solution. What are the big things we can do? And my frequent answer is, well, unless you've got $100 or $200 million sitting around, which I'm going to gather you don't, we have to look at other approaches and then tackle the housing piece from, working with other levels of government. And indeed, it is very unfortunate when housing gets sold off from the nonprofit and government sector. We have a rule in the years that I've been floating around at housing conferences. There's a general rule that once you sell it to the private sector, it's gone for good. So I certainly don't love seeing that happen. Rather see it repurposed and things like that. So, it's an important point that we're all advocating really to tap into the dollars that are there. $40 billion over 10 years has been committed through the National Housing Strategy with the federal government. So we really need to be pushing those, the existing nonprofit housing providers, regional government to start tapping into that because it is there. It's going to take some willpower and a push from all of us. And hopefully, as I mentioned before, if we're on the same page, that makes that push all the more stronger.
Thank you, Derek. There's a good question here for Temple, and I'm going to try and get as many as we can in here. Christine was asking what surveys or otherwise have been conducted of the unsheltered community to see how they feel about these shared issues. I'm not sure if that's something that yourself, Derek, or Jeff, or even you, Daniel, might have a comment on. Have you guys been doing some surveys at the mission, for example?
I'll comment quickly on what we've done. Last time we did a wider survey was maybe 3-ish years ago, so it's been a couple of years. We could definitely refresh ours, but we are doing everything where someone is comfortable speaking a little bit more. The different service providers are doing what they can to collect information. So both quantitative data, but also qualitative feedback as well too from those clients who are comfortable sharing it. As Jeff mentioned, it can take time for people to be at that trust level to really start to talk about what their needs are. But we certainly are doing what we can, but we haven't done sort of a full community scan survey at this point for a few years.
Excellent.
I see Dan waving his hand. He might need to be unmuted.
Oh. Taylor or Angela, there you go.
It's not very often. People are always muting me, even when I'm not on a computer. It's fun. They are now at the community the region is now doing a by name list. All right. And they're also doing, BI-SPDAT, which is a survey which looks at the acuity of the community. It looks at the vulnerability of the community, high, lower, in the middle. So they're putting all that information together so that it can be fed in HIPUS, and as it's fed into HIPUS with the by name list and the BI-SPDAT, we're going to be addressing the issues quickly. So it's more like if there's a problem here and this person can fit in there right now, right here, then we find solutions for them. And I think I got off on a tangent, but what was the question again, please? We were talking about.
Have you been surveying the population?
Yes. Yeah. Yes. So that information there, that Doreen and the people from the mental health industry and the people that sit down and take that information are finding they're surveying the community in a sense, finding out where the community is at. What needs to be had is the GAP committee needs to sit together, and we're going to be getting together again with the community to talk with the community about how they feel and what their perspective is, and that's on our agenda over the next couple months, especially coming up to winter.
I believe this is from one of our BIA member city businesses down here in the downtown. How can business owners help to mitigate some of these issues? I think you kind of touched on that about having $100 million there, Derek, but any other thoughts specifically for Cindy's question on that front?
Yeah, I mean, I think education is a big piece of it. It helps us to advance, sort of get further ahead in the curve.
So you mean like education for them and their staff in the store about responding, de-escalating, or?
Yeah, I think the whole gamut, whether it's when it might be dealing with, one-on-one situations, as well as understanding the root causes of urban poverty and addiction. I think that the more you know, and the better equipped you are in those situations, and also who to send them to. Sometimes somebody is willing to talk to whoever is that person at the storefront, or restaurant front point of contact, and maybe just even knowing enough to where to send them, which agency might fit their particular situation best. Or we tell people, if you're not sure, just send them to the mission, and we're happy to direct people if we're not the right spot, because we're fairly close. We are downtown and easy to find. But I think that Welcoming Streets, their piece where they are, where they offer various forms of training, de-escalation, and so forth. I would say tap into these things, reach out to people like Dan Cullen, who can maybe give a bit of a reference point from someone who has had to live it. And I don't think that there's going to be any one sort of sweeping answer as to what they can do, but I think that, and also talk amongst yourselves within the community, within the business community, and the restaurants, the storefronts, the professional offices, and so forth, to do a little bit of brainstorming yourself as well, in terms of what you feel like your role as a community is, what your resources are best positioned to do to support, and take a partner orientation with the social services that are in the area. We don't want to be in an adversarial relationship. We want to be in one where everyone is comfortable to reach out to each other. If you have a question or you're not sure where to send someone, we really want to have that open line of communication as well.
Exactly. And we've got a great group of people here. I think this is even just a small part of the army that's out there for folks who are all wanting to bring positive solutions to the table, and we need to continue to work together. Differing opinions is an important part of what helps to bring forward the best ideas that we can come up with for solutions on these things. We're already up to 9:30. Daniel's had to go, unfortunately, he had another appointment to attend. We have your questions captured in here, and we want to thank everybody. We hope that you have found education in this through Derek's presentation about the issues in that very short bubble that we had. Jeff's description of the Welcoming Streets program and how it can help businesses downtown, when and why you reach out to them. Some of the challenges that are ahead of us right now, some of the questions that we then covered this morning. If you do have more, please continue to fire those questions into the admin@downtownoshawa.ca address. Any sort of closing remarks? And Adrian, yes, we see your comment there about lobbying the city public washrooms reopen. Maybe actually that's a question. I don't know if Derek, do you know if you can tackle that one here about the washrooms?
We have swung on that pendulum back and forth quite a bit in terms of the best way to respond. That's one of the reasons why the porta potties were installed. That was the city and the region doing that together. You know, at the mission, one of our goals was to get washrooms open and available as soon as possible, but unfortunately they don't cover the full day, only till 7 p.m. You know, I think that the part of the challenge there was that people weren't using, you know, they were using the library washrooms to be sure. But beyond that, most of it wasn't city facilities they were using. It was just sort of, you know, duck into a restaurant. Hey, can I use your washroom? Pop into a store. And now because of the COVID restrictions, we're looking for alternatives. But if you see any, I'll call them hotspots that could really use maybe some of those porta potties, maybe we can look into seeing if you know, if there's some underserved blocks or something, see if maybe we can get some other ones installed there in the meantime.
Excellent, thank you. And bear in mind, yeah, with COVID, every time a washroom is getting used, it has to be sanitized frequently to maintain our health standards around prevention of the spread of disease. And then even in the provincial parks, for example, if anybody was trying to go camping this summer, you would have found that while the washrooms were open, the showers weren't at the provincial parks. So if you didn't have your own shower in a little camper trailer, then you were kind of out of luck. So that is a little bit over our hour. Again, do keep firing the questions to admin@downtownoshawa.ca. This is by no means, you can't solve all the world's problems in an hour here. We are so very happy that you've all joined us. We are very happy that you're asking these questions and continue to ask those questions. We need your input and your participation and your engagement to help tackle these kinds of issues. Don't let the items rest. Keep asking questions. Thank you for joining us today. Thank you to Derek and Jeff and Daniel for your presentations. Thank you to everyone else for making your time available this morning to be here. We know that you have busy days and other things on your plate. Thank you to Angela and Taylor for working in the background to organize some of the questions that came through and fire them over to me here and track all this stuff. Again, this is going to be made available by about the 23rd of September. You will also get an email. Members will get an email later today with a survey about this session. And this was just the first one. We're going to learn from how we did this one to then do better with the next ones. And so thank you everybody for being here. Appreciate it.
Thanks, Paul. Thanks, everyone.
Thanks, Paul.
Have a great day, everybody.